and today we're going to talk about exclusion rules. There are risks out there that very few people know about. People working in doctor's offices, hospitals, nursing homes, billing companies, pharmacies, they're all under the same kind of a risk. And there's a danger they don't even know about that we need to talk about today. Now, we're going to be talking about exclusions. Someone can be excluded from any of the healthcare programs or be on any of the OIG or state exclusion list, and sometimes they don't even know they are, or they haven't disclosed it to you. So how can somebody get to be placed on that exclusion list? Well, you can have some kind of conviction relating to healthcare fraud, or maybe it's related to a controlled substance that you smoked back in college or in high school. It could be a conviction relating to patient abuse, or even some kind of a conviction relating to obstruction of an investigation of an audit. You could have had conviction of food stamp fraud, or even failure to pay child support in another state, maybe not even in the state you're in right now. You might have been charged with failure to grant immediate access. You don't have to have a conviction there for the feds to make that one stick. Or entities controlled by a sanctioned individual and you work there. It could be that you had a failure to report and return an overpayment that you know about, or failure to grant OIG timely access to records whenever they've requested it. And again, you don't have to have a conviction there. Just a charge itself can have you placed on an exclusion list. Or if you've ever made false statements, omissions, or an enrollment application to participate in a federal health care program. Perhaps you're the office manager. You just filled out the application for the Medicare or Medicaid with the information that the doctor or nurse practitioner or PA gave you. It doesn't necessarily have to be that you intended to defraud. So what employees are we talking about that cannot be working for you if they're excluded? Well, according to the federal records right here, and the interpretation by the OIG is there's a payment prohibition on any item of service performed by an excluded person. That includes the physician, the NPA, or the CMN, or therapist, or even the office manager. I had a doctor a while back ask me if he could hire an excluded doctor to work as his office manager since he couldn't practice. I said, he can't do almost anything in your practice. If he's excluded, he cannot be doing anything. It can be a nurse or an MA. It could be a billing clerk or a receptionist who's entering in the data into your computer on the patients. It could be the person drawing the blood or the lab technician that's working in your office, even if they're contracted. They don't even have to be your own employee. Or a diagnostic service that comes in twice a month and does ultrasounds in your practice. If the person if the person that's doing that has been excluded anywhere for any of these major or minor problems, you can be the one that will be fined. Or it can be someone that's at your billing agency, your billing service that you're using, that's filing the claims for you or doing the appeals. It could be the person coming into your office doing information technology support. If any of these people in your office or on any of the exclusion list anywhere in the country, your practice will be the one that will be fined. And the government has been doing this for several years to the tune of literally hundreds of millions of dollars, huge amounts of money. Now, the CMPs can be assessed to you if you should have known that the claim was false or fraudulent, including any claim for any item or service furnished by an excluded person. Now, that person could just be the person in there sterilizing the equipment, or it could be the person drawing the blood, or it could be the person that's key punching the patient HIC number and their demographics into the computer because they got busted in college and they never told you that 5 years ago that they were arrested for marijuana use, or that they're behind on child support in another state or in your own state. This has been broadly interpreted by the OIG as an authority to issue civil money penalties of $10,000 per claim that was filed to the federal government on any federal health care program. Now, when we're talking federal health care program, we're talking about Medicare, Medicaid, TRICARE, and this one right here that's going to kick you in the teeth is any commercial insurance where the patient received a PPACA subsidy. In other words, anybody who got a policy off of the Obamacare federal or state website, if they received any subsidy, that then becomes a federal health care program. Bingo, that's where they're going to nail you. And the old method of just screening upon when you hire them and not worrying about vendors or contractors will be deemed and has been deemed unacceptable to the OIG. And we're talking about some very significant civil money penalties. Typically, most of the penalties are running somewhere between $50,000 and $80,000 when they find an employed person in your clinic and you have not been screening them monthly. But in some cases, I've seen it be $1.8 million. There was a $350,000 case where a nursing home recently. They had a couple of employees that worked out of, and they had a bunch of nursing homes, but they had a few employees, and they got nailed big time. The OIG stance has been supported by the courts and judges. The OIG goes to the judge and says this person should have known that this particular person that they've employed is excluded. And it's real easy for the government to do this because they get your tax records. Once they get your tax records, they know what employees you're paying, either on a W-9 or W-2 or 1099. So then they find out if that person, or if it's working for a billing agency that you're using. Then they go back in there and they hit you with the penalties because someone that has something to do with any of the filing of the claim or any of the preparation of service or any of the rendering of the service was excluded. And they're nailing doctors for this right here. So you have to do a monthly routine screening of every employee that's in your practice. Now, you can do it yourself, or there's an easier method. You can go to exclusionscreening.com that was started by a couple of D.C. attorneys. Both of them have Department of Justice and OIG experience, and they created a program. You give them the list of your employees' information and let them do it every month. Because if you do it yourself, you're going to have to prove that it was done. That means you're going to be hitting print screen as you go to the LEIE. That's one federal database. Or you go to the SAM list. That's a different database that includes anybody that's ever been defrauded the government in food stamps, or they had a government contract that they didn't keep up with, or et cetera. Then you have to go to all 50 states and make sure that the person that's your employee is not excluded in any of the 50 states because, again, they had a minor drug bust, or they worked for somebody and had some kind of a hand-in on a major deal, or they were behind on child support payments and they got stuck on the exclusion list. There are more than 66,000 people just on the federal database and almost that many on the state databases that you have to go to. Some of the databases in the states are in PDF, some of them on Excel, some of them are in Word. So then you've got to go through and scroll through and make sure that this person that you're looking for, you've got their nickname, because sometimes it might have been under a maiden name, or it might have been under a married name and they've given you their maiden name. And then you got to go through and do all this right here and do all those print screens and save that data to give the government. So you can go to my website, theshop.donself.com, and take a full-hour webinar on how to do this rather than this little mini webinar, and find out exactly, and you'll see the links of every one of the pages in the webinar if you buy it, and you'll find the links of all the pages that was current as of the last time I did that particular webinar, because they do change. Or like I said, you can do it as an easier method. Go to exclusionscreening.com. It's typically for a 1 to 4 physician practice. It's going to run you about $59 a month, which is less than you probably spend in a month on morning coffee. A 5 to 9 physician practice is probably going to be right around $100. And if you use Self1 as a discount code with them, you're going to save about 10%. You'll save 10% on the bill, on your monthly bill like that. So this is something that you have to do, or you're going to be fined. And again, the full webinar goes through and gives examples of the actual fines of the physicians in the hospitals and the nursing home and the pharmacies and the billing companies as well. Because don't forget, if your billing company is employing someone who's on an exclusion list anywhere in the country, it will be you that filed the claim through that billing company that will get the $10,000 fine. And trust me when I say the OIG is going after this big time. We'll be glad to help you if you have any questions. You can email Crystal or I, and we will be more than happy to help you get set up with them. Just make sure you use Self1 as a code, and you'll get that 10% discount. Here's Crystal's email. Here's our office phone number and our website, donself.com. Don't hesitate to contact us if you have any questions. We are here to help you, and thank you so much.